Secretary Smith. Good morning. I'm pleased to be able to provide an update on the work of reopening our schools. Last week, we reached out to our districts to understand the patterns in their reopening plans. As expected, a majority are implementing some aspect of hybrid learning, where students are engaged in both in-person and remote learning at the same time, or different groups of students are doing so. We have approximately 60 school districts in the state. We were able to obtain information on the plans of 49 of these districts as of last Friday. Of these 49 districts, 46 will have some version of hybrid learning. 3 will be remote. Several districts are in the process of finalizing their plans this week. Hybrid learning is taking several forms. 75% of these districts that responded are having 2 days a week in person and 3 days remote learning. 20% are having 4 days of in-person and 1 day of remote learning. We will continue to monitor these plans as we get closer to the reopening of school, and we'll be collecting monthly data on the implementation of hybrid learning so we can understand the patterns of access and opportunity. The focus of districts and the Agency of Education is now on the how of reopening our schools. We are interested in maintaining stability in our state-level guidance as much as possible. Last week, we issued an update to our health guidance. I do not expect to make any further changes to this guidance prior to the reopening of schools unless new health information or a change in health conditions warrants it. We are focused on producing guidance on applied aspects of the health guidance to specific instructional situations. For example, last week we issued guidance on sports and guidance on social and emotional supports for students. This week, we expect to publish guidance for our pre-K programs. We are also working with our partners at the Department of Health on building out a robust list of responses to frequently asked questions regarding the implementation of our health guidance. As evident in the focus on hybrid learning in our reopening plans, we continue to build out our capacity for remote learning statewide, even with our focus on in-person instruction for younger students in grades pre-K through 5. Our state-level efforts to improve remote learning for all students include expanding access to the Vermont Virtual Learning Cooperative. As of August 1st, we anticipate about 25,000 Vermont students will enroll in a VT-VLC course this year. We also formed the first ever state-level instance of Edmodo, the popular education network site for teachers. Edmodo announced last week that they have reached an agreement to embed Zoom video conferencing into their platform. We will be following up with Edmodo this week to explore bringing free Zoom access to all Vermont districts as part of their participation in the Edmodo platform. Another technology tool we are exploring is a statewide app for the implementation of the required daily health checks in schools. We hope to identify a technology solution this week. All the technology investments for the support of our districts in this emergency are being funded by federal dollars. The financial aspects of reopening schools are an important consideration since schools have had to make adjustments to not only how they teach, but also how they address the safety considerations of their buildings. I thought I would provide an update on the funding for reopening our schools, which largely comes from the CARES Act. The CARES Act has 3 pots of money for K-12 education: the Coronavirus Relief Fund, or CRF, the Elementary and Secondary Schools Emergency Relief Funds, or ESSER, and the Governor's Emergency Education Relief Funds, or GEER. The General Assembly appropriated $50 million for K-12 education reopening costs under the CRF. These funds were allocated under specific programs, and each program must get separate approval by our Fiscal Oversight Group to ensure the funds are used in a manner consistent with the CARES Act. The Summer Food Service Program, totaling $12 million for the delivery of meals June to August. The application for those funds went out to districts in late July. The applications are now closed, and we had 31 summer food service programs request a total of $1.3 million in reimbursement from the CRF fund. The HVAC program with Efficiency Vermont, totaling $6.5 million, was finalized last week. We are now working with Efficiency Vermont to get those grants out to school districts. Efficiency Vermont will handle the grant applications, and then the reimbursements will be sent to the Agency of Education. The largest CRF program to schools, the General District Reimbursement Program of $29 million, was recently approved. The application will be going out to districts this week. Districts will be able to access CRF funds to cover COVID-19 related expenses that occurred from last March and going forward to this December. Second pot of funds, ESSER, the Elementary Secondary School Emergency Relief, is about $30 million, and those funds are awarded directly to school districts as per the CARES Act, and can be used more flexibly than CRF funds. For example, we learned last week that ESSER funds can be used to cover teacher childcare costs. ESSER funds can also be used over a longer time frame through the end of September 2022. The ESSER application has been available to school districts in July. The Joint Fiscal Committee gave approval to this program last week. We've been working with them to identify solutions to the shortfall of the Education Fund, including exploring to what extent CRF and ESSER funds could be used to address the shortfall in the Education Fund. We will continue these conversations with the legislature in the coming weeks. The third pot of CARES Act money are GEAR funds, or the Governor's Emergency Education Relief Funds, which total about $4 million in Vermont. The governor has decided to direct the use of these funds to support career and technical education centers. The GEAR application will go out to CTE centers in September. These funds, too, can also be used through September 2022. In summary, federal CARES Act dollars are being rolled out to districts, albeit more slowly than originally anticipated. I would like to thank the finance team at the Agency of Education for working rapidly to stand up these new complex programs. Current federal funding seems to be sufficient to address the immediate reopening needs of our schools, but the larger long-term costs have yet to be identified, no doubt will require additional federal help. That concludes my update on the reopening work. Now I'll turn it over to Commissioner Levine.
Good morning. We'll begin with a health update. Over the weekend, we reached 1,530 total cases in Vermont. The number of deaths remains fortunately quite static at 58. If we look over the last 4 days, we've had new case numbers that range from lows of 3 to highs of 17. Similar pattern to what we've been experiencing all along. While a number of the cases were in Chittenden County, they do not all seem to be connected to UVM students returning, nor to any discrete outbreaks, nor are they epidemiologically connected individuals. For the last week, Vermont was indeed noted for being the state with both the lowest number of new cases per 100,000, 8, as compared with the national average of 112, and the lowest percent positivity rate, which remains, as you can see, well below 1%. 62.4% of our new cases come from 3 counties, Chittenden, Rutland, and Bennington. Now moving on from the data, a few items on the testing front. First of all, we've discussed serology testing many times at these conferences and the idea of seroprevalence studies. These studies assess what proportion of the population has come in contact with the SARS-CoV-2 virus that causes COVID-19. There's a large-scale study under the auspices of the CDC that involves several states and metropolitan areas. Results are still pending from this. There's also a study of blood donors. That is not yet past its early stages. What data we do have comes from commercial labs, and these show a range between 1 and 7% prevalence. Admittedly, not very high numbers. Second thing on testing I want to discuss is that the FDA recently authorized the Yale Saliva Direct COVID-19 diagnostic test. Of great appeal of this saliva test is the fact that it doesn't require any additional or sophisticated collection devices or swabs even, just a specimen cup. and it does not require separate nucleic acid extraction, which is, of course, the step that's done in the laboratory. And that's quite a benefit in case reagents become in short supply for the various laboratory platforms we use. What we don't yet have an appreciation of is what are the performance characteristics of this test in terms of its sensitivity and its specificity, and what settings is it most appropriately used in. I've tasked my public health laboratory team with exploring this mode of testing further and seeing if it should become part of Vermont's armamentarium. Finally, to provide some thoughts on college and school reopening. I'm sure by now everyone has seen yesterday's big news regarding the University of North Carolina at Chapel Hill, a place that normally has somewhere in the range of 30,000 undergraduates. It had 130 students test positive in the first week. The school recorded a positivity rate of 13.6% out of the almost 1,000 students that were tested, and they also had 5 employees who tested positive. The state percent positivity rate at this time is in the 7% range. Now keep in mind that unlike Vermont, they were not testing students upon arrival at campus. Currently, there are 177 students isolated and 349 quarantined on and off the UNC campus, and they have now abruptly and fully transitioned to remote learning. To now segue to our experience in Vermont thus far, where students admittedly are still in the process of returning, we've had 4 students test positive at Norwich, 1 at VTC, and 6 at UVM. Once again, I'd like to reiterate what I said last week, though. While we understand hearing about new cases of COVID-19 is cause for concern, these positive tests mean the system is working. We actually want to find these cases as the campus begins to regroup, so we know who needs to stay inside and away from other people, so we can prevent the virus from spreading any further. The combined early testing and quarantine protocols that all of the colleges in Vermont have put into place will enable them all to protect the health and safety of their students, staff, and community as the fall semester gets underway. Regarding pre-K through 12, I'll just merely echo what the governor said. The trends we've been seeing in our state for some time now continue to tell us that it's the right time to bring our children back to school in the carefully considered, measured, and safe way that we've laid out together with education leaders, pediatricians, infectious disease experts, administrators, school districts, and public health experts. Of course, we know there are risks, and we hear and understand the fears and anxieties of parents, teachers, and staff. Had we the experience of so many other states, we would very likely advise a fully remote school year. But the data continues to support our conclusions to date here in Vermont. That younger children are less likely to transmit the virus, become infected, or develop severe disease. That adults in a family are more likely to be the index case in an affected family, not the child. And that studies from around the world have not shown significant transmission of COVID-19 within schools. And as I've said many times before, we will continue to see new cases, clusters, or even limited outbreaks in our communities. But the public health protocols we have been employing over the past many months, testing, contact tracing, interviewing, and advising people who have been in close contact with a person who has COVID, really work, and will continue to work to limit the spread of the virus.
With that, we'll